14 years ago, we began a journey in East Africa and really didn't know where it was going to take us. What has unfolded in those 14 years awakened, I think, all of us to a part of the world that none of us had much experience with.
When I went to Africa, it completely changed my perspective about everything.
One of the things that was so heart-wrenching was that in many instances, when I saw a child, it was the first time they were seen by a doctor.
Complaining about your cell phone not being fast enough or the freeways being clogged. When you go to a country like that where the rent's $5 a month and they can't even afford that, they can't even afford money to buy food to take their meds with, but they're always smiling. I didn't see once, when I was in Africa, I never saw one person who was not smiling. I never heard one person complain about anything.
I remember that there were probably 8 of us in this room that was maybe 8 by 10. That was this family's entire life and existence in this spot. And there was a mother, father, and 2 children. And their biggest concern in life was that they didn't have the money to spend for rent. They were behind 3 months in rent, and it was $15. Literally, we all had tears coming down thinking, oh my gosh, $15 is making such a difference with these people. And of course, we just pulled out the money and paid their rent. And we knew that day we had really made a difference in someone's life.
The trip really reaffirmed that there's a lot of people out there who don't have access to the resources that, we're used to here. And there are still people out there that need a lot of medical attention.
So to really build a clinic and to have a facility wherein kids can be seen and can be given at least a diagnosis or at least credible medical advice and treatment is going to be just amazing for them.
Humanity really is the same no matter where you are.
One of the main reasons to give is that we have so much at our disposal here that they just absolutely don't have. I don't think people realize that if they made even a $100 donation, how far that can go. A $100 donation can buy months of medications. A $100 donation can buy furniture for a waiting room. Anything that can be given can truly make such a difference there.
When I donate to a charity, one of the first things I look for is what percent of each dollar goes towards program services as compared to administrative costs.
Every penny that's donated goes to East Africa and goes to the project. We don't have any overhead.
I can tell you that there's no paid staff at the Phil Simon Clinic. Dr. Schreiner doesn't get a salary for being the director of the Phil Simon Clinic. So every dollar that you donate goes directly to program services in Africa.
The donations are everything because when we arrive there,
we hit the ground running.
And things unfold in a very meaningful way.
So we go there at night, we sleep for a couple hours, and the next morning we're on Land Rovers on our way to the clinic.
We have little more than a commitment to making a difference and the medicines we're carrying with us.
We work side by side with Tanzanian healthcare workers and focus our attention on mostly underserved populations in the area.
The most rewarding thing has been to see over the years how much has changed in Africa itself.
There were 2 people to a bed, and the beds were like this big.
We've seen people come into the clinic like hobbling, bent over with diarrhea and emaciated, completely ill.
And you'd see 2 or 3 or 4 patients who were actively dying in a bed.
When I got there, they had a year of medications, and there were empty beds. So that's how significant it was.
There's these lines and lines of people who've heard that, there's doctors coming to see them, and they've been having to see a doctor for maybe like a year or 2.
It wasn't unusual to have kids lined up 50 deep just upon our arrival.
And they will sit there patiently for 6 hours in the hot sun.
I think that's really affected the people there when they know that there are a team of doctors coming that can actually provide help that they've been really needing.
Each time that we go there, you realize how little they have, but how proud of a people they are.
They just lit up.
It's hard to even consider the kind of adversity these people may face on a daily basis, just in terms of inadequate food supplies, inadequate shelter, inadequate access to medicines.
It's something that we don't even think about here. It's just so common.
I think the main reason why most people should donate to this cause is because it really does have impact. When you do donate money, it goes for a very specific purpose.
Many of our donors have actually gone with us and become personally involved in the project. So you're traveling to a beautiful part of the world, experiencing things that will absolutely change your life, meet people that will change your life. I think that speaks to itself.
All of those medicines are made available by donation. When we had the privilege of being able to take an ultrasound machine with us and we're able to make diagnoses based on the findings that were elucidated with the ultrasound machine, all of that is through donation.
When we first started going, they actually had no medicine, no testing or anything.
There were very limited resources in terms of diagnosing AIDS.
We've seen tremendous growth in that short period of time.
Now about 12 million people on the African continent have access to antiretrovirals.
There were huge needs that we've only kind of begun to scrape the surface on, which is one of the other reasons we're so committed to building the clinic there, that some of the work that we've initiated can be ongoing.
One of the things that I thought would be very helpful for sustaining our impact in East Africa would be to help put somebody through either medical school or nursing school.
Ezekiel Noah expressed an interest in going to medical school.
Ezekiel was a clinical officer at Uponi Clinic when we met him, and I was very impressed with his intelligence and his enthusiasm and passion for medicine.
We said we would do it if he would come back to his own little village and be a doctor there because he didn't have a doctor.
It has been helping many people who are really in need. We have seen a lot of people who are sick, but the project, in spite of being non-profit project, but I can say that this project really has something inside which is very big.
And Ezekiel had the will and the desire to become a physician. So thanks to many donors and several families in particular, we were able to provide tuition for him. He got into medical school, attended medical school, and he's now doing his residency in internal medicine, which is a very rare thing to be able to do in East Africa. And that all has been provided by the many people that have donated to the clinic.
I wish you all the best, and I want to say thank you for everyone who is really devoted, who is really going to do this, because he's not doing only for me, he's doing for all over the world. I believe the Phil Simon Clinic have started in Zongo today, and it is going to spread all over the world.
Those doctors that go there, when they come back here, I think they have a whole different perspective about their own lives and the patients they treat here. They're way more compassionate and sensitive to issues they maybe would not have been had they not gone to Africa.
You come back with a mix of feeling abundantly appreciative, if not maybe feeling a little bit more responsible that with comparatively little effort, we can make such a tremendous difference in these people's lives.
As a doctor, going to Kasango really opened my eyes.
I support the Phil Simon Clinic because of Dr. Schreiner's enthusiasm and compassion. I mean, she's one of the first doctors in Southern California that I know of that had this concept of going to Africa and helping people over there.
One of the things that we helped set up was home visits for Africans by Africans, and that organization is still running today.
We've really focused our attention. The project is no longer just an HIV project. It's a medical and surgical project. It's social work. It's the arts. It's education. It's infrastructure.
It really does impact a lot of people's lives when you get there. It feels very special.
It's pretty amazing. I can't even imagine the hundreds and hundreds of lives that have been changed or altered by what Dr. Schreiner and the Phil Simon Clinic has been able to do in Africa.
Your money is not only going to change lives, your money is going to save lives. And your money is going to save lives on a bigger scale than is even imaginable.
Hello, this is Jane Goodall. I've been working in Tanzania since 1960, and I know only too well the poverty and the lack of even the most basic medical facilities, which affects hundreds of thousands of people. The Phil Simon Clinic Tanzania project makes a huge impact on local communities, those fortunate enough to benefit from the skilled volunteer team. During the years I've lived in Tanzania, I've seen huge advances in healthcare in many regions. There is a desperate need for more trained doctors and nurses, but the number continues to grow. Dr. Kim Schreiner is passionate about helping the people in Tanzania, using her medical skill to alleviate suffering, inspiring other doctors and nurses to join the program. She is a wonderful human being, as well as a skilled doctor. To all of you attending this event, I have just one simple message. The Phil Simon Clinic Tanzania project is truly a wonderful project. I believe it's a particularly worthy cause because it involves the donated time of so many skilled volunteers. I would urge you to support this effort. I know from first-hand experience just what a huge difference every dollar will make. I would urge you to tell your friends about the project. Thousands of suffering people will be so very grateful. So many lives improved, so many lives saved. So please give generously. Thank you.
There's a very famous African proverb, if you want to go fast, travel alone. If you want to go far, travel together.